Hello, everyone. Um, Welcome to our weight loss surgery webinar, monthly webinar, which we hold every Saturday of the month. And I'm just still waiting to see for everyone to join. Meanwhile, I like to make sure that you guys have submitted the health questionnaire from our website on MBC Mexico Bariatric Center.com/health questionnaire. And basically, if you have submitted the HQ before, you don't have to redo it. But if you're doing a new, fresh one, please select Dr. Miguel Montalvo as a surgeon of your choice and watch the webinar to the end. That's a requirement to be entered to our $2,000 off of surgery package raffle. And basically, this raffle is for the procedures that Dr. Montalvo offers. So if you are with a different surgeon, your HQ has been approved, you need to be able to switch to Dr. Montalvo. So again, I like to say hello to everyone that is joined us today for our monthly weight loss surgery webinar. And I have pleasure to have Dr. Montalvo, Miguel Montalvo from our office. Hello, how are you? From our office, from hospital in Tijuana. I hope everyone had a great Thanksgiving holiday, and we all look forward to the Christmas and New Year holiday. But here we are. Just make sure again you have submitted the HQ, and is required that you watch this webinar all the way. We try to cover as many questions that are commonly asked during our presentation. So I like to ask you please to pay attention so we don't have to answer the same questions. And basically the topics that we're going to cover today is about obesity, risks of obesity, weight loss surgery as a cure for obesity. We talk about Mexico Bariatric Center. What is it that we do to help patients that have obesity problem? And Dr. Montalvo is going to then take over and talk about all the laparoscopic, endoscopic, all the options for you. And at the end, we go over the bariatric vitamins that are essential in the recovery period and after. And then we open up for Q&A, question and answers. At that time, when you're done, hopefully we can cover all the questions that we get. And if the time allows, of course, and we do the raffle at the end. Obesity is a chronic disease, a multifactorial disease that is invading the planet. And during COVID, we realized how essential it is to live a healthy life. Basically, our body doesn't know what to do with high calorie food, processed food, sugary drinks, sugary food, and what they call them ultra processed food. And based on our genetics, our developmental history, our environment that we're exposed to, we may run into having extra body fat. And of course, the lack of physical activity, the way most of our states are set up. We don't do enough daily walk or exercise. And of course, modern conveniences, stress, is a huge, comfort eating. We all know about that. And addiction to food, inadequate sleep, the drugs that we take for conditions we have, they're all contributing to this problem. And the way medical society or medical um, industry is working, they came up with a formula that you plug in your height and weight, and that was the concept of body mass index, which is BMI, and that determines if you're over 30, which you're obese now, and then we are looking at morbidly obese and super morbidly obese and super morbidly obese. And something we need to pay attention here is that we pretty much qualify patients that are over 30 BMI. Of course, it could be little under, it depends on if you have metabolic disease. And we go all the way, there's no limit of what BMI we can handle. So we have actually, our surgeons have handled BMI of 102, 95, 98. So there is no limit of what our surgical teams can do. Um, so basically, the fat cells not only grow in numbers, they also change structure as we gain weight. And changing that structure, causing our body not to be responsive to insulin, to leptin, to therapies, to vaccination. And before, they thought only just, we just increase our fat cells, but that's not true. The adipose tissues actually get inflamed, and all these diabetes type 2, everything is happening because of that. Major risk factor. We actually, during COVID, we realized how important is to stay healthy and, lose weight and be having a good healthy lifestyle. And it's impacting over 40% of our US people. Of course, this is worldwide. And really what happens is when we gain fat, the fat in the abdomen is pushing against our lungs. And I like to always show this animation to see what is it that is happening when we gain weight.
Consider this. Our diaphragm is one of the major muscles that helps with breathing. Breathe in, the diaphragm contracts, and the lungs expand to take in oxygen. And if you're obese, fat in the abdomen can push on the diaphragm, limiting it.
Again, we talked about diabetes type 2, heart disease, lung disease, stroke, impaired immune system, inflammation, and again, coronavirus was a awakening call for all of us to make sure that we cure this problem. And so now we come to, okay, so we all know what obesity is, we all know all these facts. So what is the cure for that? So it's a classical way of dealing with it, which is, okay, let's go on diet, let's do exercise. And of course, that exercise is always essential to our well-being, but it shows, the data shows that it's not a proven long-term solution. So, and we will see why diet is what happens when we go on diet shortly. So, and then the drugs that they always look for this magic pill that they would take and lose weight. Of course, the recent development on those anti-diabetic injections and pills like Ozempic has been, shown that they not only it helps with the diabetes type 2, it also helps losing weight. And but again, you have to keep taking Ozempic, and then we'll go over that a little bit, touch on this subject about, okay, so if you're not diabetic and you're taking this, what is the long-term effect? You're basically injecting a bunch of hormones that is trying to simulate the effect of bariatrics. And, when you actually receive weight loss surgery, it's those hormonal changes are naturally happening due to the surgery. And that's what they're trying to simulate the effects of those by injecting more hormones into your body. And we hear, side effects from that. But basically, at this point, still bariatrics is the gold standard and is a proven way, quick and safe and long term, to lose the extra fat and get to your ideal weight and your goal weight and keep it. Of course, nothing comes easy. You still have to do the work, but it gives you that tool to be able to overcome this problem. We were talking about diet, right? So when we go on diet, basically our body is going to push back by lowering our metabolism, increasing our hunger, and we don't feel that satiety. And that's why the first maybe 1 week, 2 weeks after the diet, we'll lose the weight, and then the body starts resisting from there. And that's why it's hard. And when we talk about exercise, we talk about boot camp type of exercise. Not, of course, anything we do every day is like even 10 minutes, being on the treadmill, walking, it helps a lot. So we were talking about hormones. So what bariatric surgery does, they call it bariatric and metabolic surgery for a reason, because it calibrates or resets your metabolic system. And the difference between, let's say, this person in the red that is 200, that weighs 250 and goes through excessive diet and extensive exercise. And let's say this person manages to lose 75 pounds. The brain is used to interacting with your gut hormones at the 250 level. Your body's thermostat is set at that point, and when you go to 75, what's going to do is going to resist that by, again, increasing your hunger and lowering your metabolism. Now, the bariatric surgery, the minute they change your gut hormones and your hormones changes, now your brain and hormones are interacting at a new level. The minute you wake up, it's like your body's thermostat, your metabolic system is reset to the lower thermostat at 175 pounds. So what's the consequence of that is your metabolism goes up, your hunger goes down. And that's the magic for that. And that's what Ozempic and all these, other drugs trying to simulate. But let's say even Ozempic is only doing the GLP-1. There are so many hormones involved in when you change your, when you go through bariatric surgery. It's not just GLP-1. It's so many other ones. So, and it's happening naturally. And that's why it's so effective. And that's why it's so quick. Of course, we hear, again, the only problem I would have had with Ozempic and these drugs is you putting hormones in your body if you're not diabetic that you don't really need. So what's the consequence of long term, of putting these hormones? You hear all these problems. But again, you can look at this pyramid that, Dr. Montalvo later on is going to also touch base on this, that, the diet and exercise, we don't say it doesn't work, but not for everybody, maybe 3 to 5%. And then it comes these semaglutide injections like Ozempic, Wegovy, Mounjaro. And here's another problem with these, because Ozempic is not a anti-obesity drug, is never approved for that. Wegovy is the one approved, and from what I hear, it's impossible to get your hands on. And Mounjaro is not even FDA approved yet. So basically, people say, okay, we just take Ozempic, but Ozempic is not really FDA approved. Anyway, and then it becomes endoscopic procedures. Of course, again, this is not for everybody. Endoscopic procedures can help a portion of the people who have experiencing being overweight, like gastric balloon, endosleep. These are good for people who want to jumpstart. They have discipline. They just can change their lifestyle. And then it becomes bariatric surgery, which is the definitive answer to obesity, like gastric sleeve and bypass. Dr. Montalvo is going to touch base on those later. Those are like you can lose 100% of your extra weight and get to your ideal work. Of course, they say, oh, you lose 60, 75%, but that's not true. We see patients, gastric sleeve, bypass for long term. They're keeping their weight off. They're using their tool, and there is no limit. So now the question is, okay, this procedure is involved because the instrumentation, the equipment, the hospital stay is expensive. And if you really go to a full-blown hospital and stay the 2 nights for sleep and 3 nights for bypass, it can cost all the way to $80,000. Of course, you can get it for cheaper, maybe 25,000, maybe a little cheaper. But if you are uninsured or underinsured and you can't afford it, you can't afford to pay $25,000 out of your pocket. This is just for sleep. Of course, bypass and DS is even more expensive. Then you look into alternative, which is medical tourism. Medical tourism comes into play to help patients by going to other countries. So, but what Mexico has done, and we have done in Mexico, is we have created a safe tunnel for you guys to go in there, have the transportation, have the support, have the coordinator around you, and have the top surgeons working exclusively in an environment to help patients get these life-saving procedure and come back. And Mexico is probably, Tijuana is probably number one for weight loss surgery worldwide. And the expertise that they have and they have acquired over time, over years, it's untouchable. Again, this is where we come into picture. Mexico Bariatric Center. I personally started being involved in this industry in 2007, and we created Mexico Bariatric Center in 2012. And again, we are a bridge for you to travel, have the driver, the coordinator, the hospital, the hotel, all in place to go in there, get your surgery with top surgeons. These are the surgeons that are hard to find worldwide, world-renowned surgeons like Dr. Montalvo that's here with us today, and get the surgery and come back. So, you know, we will go over that, why MBC. And one of the reasons is the expertise that we have acquired over time. And, we will go over that later on. Of course, you can see companies coming out of nowhere, putting up a website, putting up some Instagram, before after pictures and TikTok and make it fun. But you have to really look at what is behind the social media, what is behind the website. Because, putting up all these are easy to do, but does it have any content? Do they have the support? NBC is actually a US-based corporation. Our main office is in Sacramento. We have, of course, people working with us across country, in Mexico as well. And our mission since inception has been providing top quality VIP services to people who need to change their lives with this life-saving procedure at the most affordable prices. And if you look, what we offer is the most affordable and most appealing price packages. So, and then we always say, okay, why NBC? Our reputation, our reviews on Google, Facebook. We offer all-inclusive packages and top board certified surgeons. The patient care before, after. We have nutritionists on our staff. We have US surgeon liaison that we would see how our HQ handling and approval process works. And ease of scheduling your surgery. You can actually submit a HQ, get approval, and book yourself online. So this as easy as it is. And then you just send your information, your flight information, your paperwork, and you're done. You're on your way to go down there and get surgery. The results that we have offered, we're like a Better Business Bureau, A plus rated. Our surgeon load management that we do every day. We have over 10 years experience with NBC. Of course, myself, I have more, but with NBC, 10 years of track record with over 20,000 successful procedures. And all the pluses that we offer, we help you with your paperwork for time off. Another service that we started offering almost a year now is what we call MTI, or medical tourism complication coverage. And this is, of course, optional, but we have brought this down to a level that is so inexpensive, and you get some coverage for peace of mind. That is some, again, pluses that when you go with us, this is what you get. Since years ago, we've been looking to have our own surgery center, and since it's been 2 years now that we started looking at this project with top medical staff, are one of the best companies that they do build hospitals down there, and we are almost finished. We're to a point that we just have to get a bunch of these permits and licenses in place, and we're ready to go. This is over 35,000 square feet of facilities, and it's top notch. Everything is state of the art. And we will hopefully go live soon. And our patients are even going to be in a better position. I mean, these are just some pictures of the hospital. Um, like, as you see, like the operating room, these operating beds are one of the best that you can get anywhere for bariatric patients, and all the equipment that we're using for the safety of the patients. This is early on of the project. It's probably 2 year old. I was probably younger here too, but anyhow, Dr. Valenzuela is in the picture with me when they were started doing the framing. Again, we touched base on this. 10 years of experience, over 10 years. 2012, we started. So 20,000 and top surgeons that we work with. Our packages are all inclusive, and it covers basically enough time in the hotel, hospital, recovery, everything included. Of course, for some reason, if you need extra medications or things like that, is not in the standard package, but it's still going to be so much more affordable with what we get here. Um, we talked about ease of scheduling. You get your HQ down, you get your approval, you're ready to go. You pay the deposit, you do the paperwork, you book your flight, or you tell us if you're going to drive, and we get you there. Our support group is one of our, again, pluses, that we have two support groups, one over 10,000 of the past patients. This is a huge place that you can get support and keep up with post-op, of course, pre-op too, and see these patients that have changed their lives. And you see their before after pictures, you can interact, you can ask questions. This is a huge part of our success. And we don't not only have the staff that we work like, tirelessly every day, our past patients are a huge part of our success. Our, what we call them affiliates, like Sarita has been with us, I don't know, 8 years more. Rena, Dawn, Kelly, Elizabeth, these guys are every day working with us to support patients. Another, Rena and Sarita have been doing this podcast. I recommend you watch that. It's on mexicobariatriccenter.com/podcast. This is a huge, again, support that you get from our affiliates. So basically, you fly or drive to San Diego, and we pick you up. Our drivers pick you up. Our drivers, the team of drivers we have have worked with us about 10 years. They are professionals. They all know in and out of Tijuana. They know in and out of US. But we want you to arrive before noon and your departure after 2 p.m. And these are good ideal times for arrival and departure. Again, just touch base on, if you haven't filled out a health questionnaire, please go ahead and do so and watch these webinars today. The team of the surgeons, we have exclusive network of the best bariatric surgeons. These are bariatric surgeons with FACS, double board certification. Dr. Montalvo today, he's with us today. Dr. Louisiana Valenzuela, she's been with us since 2012. Dr. Alejandro Gutierrez, same. These are all like top-notch surgeons. Dr. Lopez, Rodriguez Lopez, Jacqueline Osuna, I mean, these are just top surgeons, and Dr. Seha. So this is how we handle your HQs. Once you submit an HQ, it goes through our system to match you with the best fit that you have with our surgeons. You know, maybe if you are BMI of 40 or you want gastric sleeve, you have no medications you're taking. It's okay, that's simple. But then again, it gets more complicated. If your BMI, let's say, is over 50, you want to bypass. And then we match you with a surgeon that is handling that, or you want duodenal switch, or you want endoscopy. So different surgeons are offering different procedures, and as a whole we have this full spectrum of we can handle any revision of surgeries, any type of surgery with a different BMI or different medical conditions. So we handle all those, and surgeon liaison is sitting in between of all this, monitoring the HQs going back and forth. Again, we were talking about, okay, so you have that page on the Instagram or Facebook. Do you have this kind of support system underneath? This is what differentiates NBC, and that's why we're successful. The pre-op diet, I just need to touch base because our pre-op diet basically is based on your BMI. And if your BMI is close to 30, you just need to do a 2-day clear liquid. After that, it just goes up. And again, if you do a really good job on the pre-op diet, the better of a job you do on pre-op diet, it will help you, if you help you and the surgeon in the surgery and the recovery. So remember that. So, and it's not too difficult. You just have to cut down on carbs and have more proteins, and maybe just have more salad and fish and chicken. And, again, try to do as good of a job as you can. Again, we talked about surgical center, what we're working on. At this point, we are using Hyatt and City Express, which is managed by Marriott. And one of the caveats of pre-op is medications, because if you're taking medications, you need to know, like, okay, when do I stop this? When do I start again? I guess NSAIDs is something you want to stop 1 week before, for sure, any blood thinners. But you'll be instructed by the surgeon and our surgeon liaison of what medication to stop and what medication to start. Again, just one thing you need to bring is please bring, if you're taking any medications, any prescription medication, bring the bottles with you to Mexico. Bring the medication in the original bottle. Okay, so pre-op, simple. You arrive before noon. We get your pre-ops done. You're ready to go to the hotel, relax, be ready for the next day. We provide broth, popsicles, um, Jello, of course. And your companion gets free breakfast. The surgery day, they tell you what time to show up. They pick you up. They take you to the hospital, and there we go. You're ready to get your surgery done. Post-op, we just, keep you 2-3 nights as we need in the hospital based on your procedures, and you on your way back to US and go back home. Again, one of the pluses that the company has is surgeons load management. So this has been one of the factors that makes us successful, is that we look at each surgeon daily load and we cap it based on the complexity of the procedure, and we're not loading them they're not like running from one hospital to the other, so they have the time. If there is any issues, they can handle. That's why our complication rate has been consistently below 1%. At this point, I like to talk about, have Dr. Montalvo take over. He is a surgeon, well qualified, academically, practically. He's a clinician that, well respected in the community down there. At least he has done 4,000 procedures. Again, he's a certified bariatric surgeon, fellow of American surgeons. And I'm going to let Dr. Montalvo take over here, talk about the procedures we offer, and go over each one as much as we can, and then I'll come back and take over. Thank you so much, Dr. Montalvo. You are.
Hi, hello. Hello to everyone. Okay, let's talk about the options that we offer. We have a lot of procedures that we can do. One starting is the the gastric sleeve. The gastric sleeve is the most worldwide procedure that is in all the world. Then the mini gastric sleeve, the single incision gastric sleeve, RNY or the mini bypass, or also called the OGB. The duodenal switch, single anastomosis duodenal switch, and various laparoscopic gastric revisions, gastric bypass reversal. It depends what kind of procedure that you need or you're requesting. About the endoscopic therapy, we have the gastric balloon, the endoscopic gastric sleeve, and also some bypass revisions. All right. Well, talking about the exercise, the diet, medication, endoscopic procedure, and bariatric surgery, most of the patients want to start with the diet and exercise. But with all these years, we saw that it's not the most efficacy or efficiency on the weight loss. So now on is people is talking about the medication and the pharmacotherapy, but obviously you're going to lose only a little percent of your overweight. Then we have also the endoscopic procedures that is less invasive and obviously is for a small percent of the patients. It's not for all. And like from last option, we have the bariatric surgery. Obviously, you make to fill out all your HQ, put all your information there so we can evaluate and suggest the best procedure for you. Obviously, with uh, this one is the most efficiency and with little more risk, but talking about the risk is very low. We're talking less of 1% all of our patients. The gastric sleeve surgery is right now the most worldwide procedure that is uh, due with all the bariatric surgeons. The gastric sleeve surgery, here we remove approximately is like the 85% of the stomach from 1 to 10 to 5 little incisions. The incisions is like 5 millimeters. So with this kind of procedure, the restriction is limit to the food intake. We change the gut hormone that cause hunger and satiety. In the part of the stomach that we take out, there go the ghrelin hormone. That's the cause of the hunger hormone. And obviously, so gastric emptying. So with this, you're going to feel full with less food. The expectations here is decrease the levels of ghrelin to increase the levels of GLP-1, increase the levels of another kind of hormones, and no changes here in the gut and the intestine. The only thing we're going to change here is the size of your stomach, but no, there's not going to be other changes on your gastrointestinal transit. Here in the pros, it can be easily revised if needed in the future. So like revision surgery from sleep to RNY or the OHB, the Lennon switch, it depends. A little percent of this patient is is going to need in a future a revision. So all of these procedures have the same weight loss. All right. Uh, other processes, a high amount of excess weight loss comparable to gastric bypass, resolution of comorbidities like diabetes, hypertension, cholesterol, fatty liver, um, and the problems on the joints, uh, cardiac problems. Is a very short recovery time. And here the cons, it can be worse, the persisting acid reflux, or if you suffer from severe reflux. And it's not reversible, this kind of procedure. The duration, approximately like 1 hour. You will be here at the hospital 2 nights. And the recovery will depend on what kind of activity do you do. Okay, the next. The single incision surgery uh, is the same. Only here, we only use one incision through the belly button. Approximately is like 2 centimeters. And over there, we put the tracker and do all the procedure. And obviously, uh, the pros here is the aesthetic approach, and the recovery, the the expectations are the same, and the cons is not for, it depends on your BMI. You need to be less of 40, and the other characteristics is the same like the normal procedure of the gastric sleeve. Okay, the endoscopic gastric sleeve surgery. Uh, Here, the surgeon put a little tube to your mouth, go to your stomach, and put some sutures there. So you're not going to have any scars from outside. Here, the pros is a reversible procedure, is the reduced complication rate, no incisions, and the cons is the potential risk of partial openings of the stomach pouch and potential risk of ulcers. So and with this kind of procedure, we're talking about the success going to be like 12 to 18 months. Okay, so it will depend of what kind of medical conditions, of characteristic of the patient have to be eligible for this kind of procedure. The duration is approximately like 30 minutes. You will need 1 night at hospital, and the recovery is very fast. The RNY gastric bypass. The RNY was the first kind of weight loss procedure. It was like the gold standard for weight loss. From now on, we have a lot of procedures. So you have a lot of options to be fit for you. So the surgery forms a new stomach pouch while the remaining stomach stayed in place. The small intestines are rerouted to a bypass food digestions, which creates a malabsorption and reduce the calorie intake. What this means that with this kind of procedure, you will you're not going to absorb all the nutrients. So it will be very important to have medical access. Why? Because you're going to need more follow up of your physician. The expectation here is only slight decrease in ghrelin, uh, increased level of GLP-1, and the GIP is decreased, especially in diabetic patients. The pros, like I already talked, was a gold standard, high amount of excess weight loss, improves obesity-related comorbidities like diabetes, high blood pressure, sleep apnea, and the cons is patient vomit and dumping syndrome and higher risk of ulcers. This kind of procedure is a little little more risk, obviously talking about less of 1%. Why this risk? Because uh, we need to make more connections, more time of surgery, more time of the OR, more time of anesthesia. Approximately, we're talking about 2 hours, and you're going to be here at the hospital two nights too, and the recovery will depend on what kind of activity you do. The next one, okay, about the sleeve and the gastric bypass, which is the one, it will depend of your medical conditions. Both of them have the same weight loss, but obviously, if you suffer from severe reflux or acid reflux or GERD, uh, the best for you will be to perform a gastric bypass. Why? Because if you choose the gastric sleeve, you can, if you the GERD or the reflux can be worse. Why? Because there's going to be more pressure inside the tube. Okay, so uh, and obviously the other condition here is the in the RNY or the bypass, it will be, we need to make more connections and the procedure is bigger than the sleep. Okay, so it will depend. That's why I put all your information on your HQ so we can recommend you the best procedure for you. The mini gastric bypass is newest uh, bypass. Okay, here in the mini bypass, the divides the upper portion of the stomach to a tube like a pouch, which holds to 4 to 6 ounces of food. The intestine or the small bowel is looped in to connect with the new stomach to decrease the amount of calories that you absorb. So here on the mini bypass, the difference with the RNY is that here we only make one connection, the most important connection that is for the bypass. The connection this is we do is exclude 2 meters of your small bowel and make the connection or the loop to the to the to the gastric pouch. And with this procedure, you're going to reduce the feeling of hunger through the altered gut, early satiety or feeling of full after small portions, reduce the calories and nutrients absorbed, then reduce or resolve the type of 2 diabetes, hypertension, cholesterol. Here the process is the single anastomosis connection, or this means that only one connection of the small bowel with the pouch. This is a safe, effective, and shorter procedure than the standard RNY, and one of the most effective surgeries to reverse failed gastric sieve and lab band. And the cons, like the RNY, they change vomit, high risk of ulcer or bile reflux. The duration is approximately like 2 hours and have from 2 to 3 nights here at the hospital. All right. Okay, which one will be the best? It will depend of obviously of what kind of medical condition. If you have of acid reflux, of marginal ulcerations, uh, the weight loss is going to be the same. The morbidities of diabetes, hypertension, and the procedure duration obviously is going to be less with the mini bypass because here is only one connection in comparison of the ROI that we need to make at least 2 connections. All right, the next one is the duodenal switch. The duodenal switch, this is obviously like if you see in this picture, more connections. It means more time of surgery, and obviously a little percent more of risk. The duodenal switch also known as biliopancreatic diversion with duodenal switch is a powerful weight loss and metabolic surgery for select patients, for a select less percent of patients. The expectation here is to lose between the 15 or 80% of excess weight loss. High percentage of the duodenal switch patients with type 2 diabetes are cured after the surgery. Here, the problem is the malnutrition that you will need to make very close-up follow-up with your physician at home. The pros is up of 80% of excess of weight loss, reduced size of the stomach. But if you see here in the picture, first we need to perform a gastric sleeve, and then we need to perform uh, like a bypass. Okay, we need to make some connections on the small bowel. Obviously, it's the high metabolic effect with the highest expect of weight loss. The cons is extremely strict vitamins required for life and the higher risk than other bariatric procedure with this kind of surgery. And the duration here is from 2 to 3 hours, and the hospital will be from 2 to 3 nights. In the recovery, it can be a little more than the sleeve or the classic bypass. Okay, how fast can I return to work after bariatric surgery? It will depend of what kind of activity you do. If you're at the office, at the computer, you don't need to lift anything. You can go back to your activities from 1 to 2 weeks. But if you're a truck driver, drive a lot of hours, just make some hard work, lifting, we recommend to wait from 4 to 6 weeks. And you will notice uh, you know your body. You will know when you can do more activity, you can start lifting, because obviously all these weeks is for recovery. The pre-op diet, you're not going to have the same um, the same like stretch or the force to do your work. So you will notice when you can return to work. So we recommend from 2 to 4 weeks for your complete recovery. But all your normal activities, you can do it immediately after your procedure. Like immediately after you go out of the OR, through 2 hours after surgery, you're going to be walking here at the hospital, and we're going to have a very close checkup for you. So don't worry about that. The recommendations that we do is like a worldwide recommendations. So bring or wear your masks, practice the social distancing, test prior to your travel, and the vaccinations.
Thank you so much, Dr. Montalvo. I appreciate you taking time and covering all this. So basically, again, this is a very affordable procedure that we offer and is all-inclusive package. But if you guys need a loan to pay off for this, first of all, what we require at the beginning is a 350 down payment. That once you pay that, you're eligible to get on the calendar. And after that, we require you to pay us 2 weeks prior to the surgery. If you're taking a cashier's check, you send the cashier's check picture image to our staff, and then you deliver it when you go down there before your surgery. Again, for the loans, you can apply for personal loan or use one of the companies we work with, like Super Money, e-financing, United Credit, and for Canadians is a MediCard. Just make sure you don't apply for more than maybe one or two places at a time, because if they pull your credit, it will hit your credit score. Just touching base one more time on our MTI coverage, which is medical tourism insurance coverage. And these are the limits that it covers. And we have made a deal with the company who provides this. They're unique. They're the only one that covered 45 days after surgery, of course, before surgery. I mean, during the post-op when you're in Mexico and you come back to US. This is all covered. It has all these limits and is only $149. That is, just so inexpensive what you get, because otherwise you'll be $400 to $500. We cannot emphasize enough of getting, first of all, complying with the post-op instructions as far as diet, activities, and one of the other caveat is this bariatric vitamins. These are the vitamins are specifically made for bariatric patients based on ASMBS recommendations and requirements, and we made like it comes in soft chewable, drinkable, and capsules, and you can kind of try to see which one works best for you. But for bypass and DS, definitely take them for sleep at least the first 2 years, because again, the first 2 years is honeymoon, you lose weight, but you want this be sustainable and won't have side effects down the line, 7, 8 years down the line. And you can find these on emergebariatrics.com. You can also order these when you're filling out your consent form. Okay, so now we're at the point that we are going over the questions, answered the questions. I did answer a couple of them. They're asking if there are any tests that we should do before we fly down there. I definitely suggest that you do a blood test, just the blood count, and basically, especially if you are a revisional surgery patient, because your hemoglobin could be down, and if you know it before you come, you can start taking medications and taking stuff for it, and you won't go down and all of a sudden figure out, oh, my hemoglobin is a 9. So definitely do that. And another question they're asking, which is I'm going to refer to Dr. Montalvo, I'm just going to say a little bit myself, is metformin as bad as Ozempic? All these medications for weight loss, the pills like metformin, these are all have effect on your brain. Even Ozempic has suicidal effects, and of course, so many other. But I see some people take metformin. So, but I let Dr. Montalvo to add anything to this.
Okay. Here in these questions, she asked because has metformin, but has bad in what form or what kind? Because obviously all these medications are made for metabolic or for a metabolic disease. All right. The Ozempic is like the GLP-1. It is related with the glucose, and obviously has secondary effects. There's that people are losing weight, is on weight loss. So why? Because like the Ozempic, like the metformin, obviously these kind of medications, you don't uh, the the hormone or the hungry hormone is going to be low, so the intake is going to be less, and that's how you're going to lose weight, and you're going to feel full with less portions. Obviously, like I already told in the when we start with this, um, talking about this, is for a, it depends of what percent of weight loss do you want to lose. Yeah, with if your BMI is low, less of talking less of 29, 28, you want to lose between the 10% of your weight. It can be a good option to start, but for people with they can afford this kind of medications, they don't make some kind of activity, uh, don't have a good diet, it's not a good option. But uh, that's why I'm asking bad in what kind, because most patients, it can be bad talking about the nausea. The metformin from some patients have a lot of nausea and then don't tolerate it. On the weight loss, it will depend how many weight you want to lose. So it's a, a big. It can we can spend all of all this webinar talking about this. So I hope I answered your question.
Okay, so they're asking what procedure do I qualify if I already had gastric bypass before?
Okay, you have an option. One of the best options is to an endoscopic procedure, because we can by endoscopic go inside your pouch and put some stitches so that anastomosis or connection can be more closed, and then you can start losing weight again.
I have very long hair. Will that be a problem for surgery?
No,
And can
no, it will depends obviously to what kind of procedure. Uh, the hair weight loss, if you um, take your vitamins, your proteins, your minerals, you're not going to have this problem, or it's going to be uh, the lowest the hair loss. But in patients with the sleep, no, they don't have this kind of problem. It's more with patients of malnutrition.
can you go over revision after successful bypass and just have about 40 to 50 pounds left to go?
Yes, obviously, like I already told you, you can have the endoscopic procedure, so you can lose that kind of weight. But first, I recommend to make like a, a restart, doing the diet and some change your activity or your exercise. Try to lose the more weight. If you think you can do it, you can come with us and we will help you.
How long after the surgery can I get pregnant?
We recommend to wait at least 12 to 18 months, because in this time there are going to be some changes of your body and the hormones to be equilibrated. But we have some surprises. Patients who told us that they got pregnant in 6 months, but and it's not big problem, but obviously there's going to be a baby inside you. You're going to have a change of your nutrition, on your minerals, on your vitamins. So in 18 months, 12 to 18 months, they're going to be like normal. So we that's our recommendation.
They're asking what is considered a serious acid reflux. I take 20 milligram of omeprazole daily.
Okay. Patients with acid reflux or GERD, obviously the best diagnostic is to have a previous endoscopy. So the physician can tell us of what kind of problem do you have on your esophagus, or what kind of GERD you have, or severe reflux, or severe GERD. The best is to have that endoscopic uh, diagnosis. But obviously, most of the patients don't have this study. So if you take daily medication, if you wake up because the reflux wake you up, the the acid reflux wake you up. If you have to put, you need to put 2 pillows or 3 pillows to get sleep, or you almost are sit to get sleep. It's that's a sign of severe reflux. But obviously, the reflux or the GERD is have a lot of factors. One of them, and most frequently, is the hiatal hernia, or it can be the overweight. Other is the what kind of diet you have. Do you make some exercise before, or some activity, hard activity before? If you smoke, alcohol, have a lot of factors.
Okay, sorry. They're asking what days of the week are surgeries done? So we pretty much have surgeries every day, including weekends, but the weekends, not all surgeons work during the weekends, but we do have availability on the weekends too. Sorry, I got distracted here for a minute. Okay, so they're asking what are the long-term lifestyle changes that they should be aware of when they do surgery?
Okay. Okay. Long term changes. Well, uh, if you suffer from some diabetes, hypertension, cholesterol, uh, sleep apnea, you're not going to need more the the medication, or the machine for the for the sleep apnea. You have joint problems, is going to have less severe, or maybe some disappear. You need to make exercise or some activity to keep your 100 of success of your procedure. You need to go with your nutritionist so you can take the only calories that you need, because if you have your previous lifestyle before you come, uh, is not going to have a good success, and patients then they think that was not good for them. So we recommend to, after surgery, to have a nutritionist, go with your physician for general exams, and to do some kind of activity or exercise to have to, this can be uh, the best for you.
After gastric sleeve, what dietary restrictions are permanent?
Well,
And will I be
this
able to have
yes,
spicy
yes.
food or carbonated beverages?
Well, we recommend to avoid the carbonate beverage. Why? Because this going to make some gas inside your gastric pouch, and obviously you're going to have distension. You're not going to feel good. Going to like burp, and obviously the calories, the spicy can bring you some reflux, but like restrictions, strictly restrictions, uh, is more related to the calories with the gastric sleeve.
Um, is there any risk of surgery years to come? For example, childbirth. Is there going to be a problem with getting pregnancy or
Well,
having?
uh-huh. Yeah, well, no. Yeah, uh, if you're trying to get pregnant in the future, or you're having problems to get pregnant, if you're having problems with your hormones, if you have some polycystic ovaries, um, or in your uh, uterus or something like that, this kind of procedures, uh, one of the effects is to that your hormones is going to be equilibrated, and you can uh, patients get pregnant in 4 or 5 months. Your facial like acne, like polycystic ovaries, uh, they get under control, sometimes disappear.
Um, how long do I need to stop Ozempic before the surgery?
All right. Uh, if you're taking Ozempic, uh, maybe you are taking for diabetes or just for weight loss. It will depend. But if you're taking because you suffer from diabetes or just for weight loss, it will depend from 1 week or when you start your pre-op diet. And it's very important to check your glucose levels, because if go up of 100, you need to take it. But if it is down of 100, stop it.
Yeah, I would say, like doctor said, when you start your pre-op, but if your pre-op is short, at least 2 weeks, because what it does, it slows down your stomach gastric emptying, and then when you are on, like for example, 2-day clear liquid, your stomach still has content in it, so it will be hard for the surgeon to deal with that. At least 2 weeks or 3 weeks. Um, they saying what percentage of gastric sleeve patients gain their weight back in 5 to 10 years? Does the bypass have higher success rate for keeping weight off in 10 to 5 years?
No, it's the same. It's the same. People think that with the bypass, they can avoid future revisions, or they are going to uh, lose more weight. But if you make some research, the successful, both of them is the same. Right now, in this time, it depends of your medical conditions or your previous characteristics or your previous surgeries, that we're going to make some recommendations. But even with duodenal switch or the uh, this more bigger surgery, you can wait, you can gain weight if you don't follow our recommendations, like the diet after surgery, make some exercise, your the visit with your physician at home. Is more that now you're going to make this inversion to keep the best way and to take care of you.
They're asking why is that the higher BMI cost more?
Okay, obviously because this means more more risk. The first characteristic obviously is more risk because your BMI is highest, your liver is bigger, your uh, inside fatty tissue is more. It takes little more time of OR, and obviously have a little more risk of the of everything. Okay, it's obviously a more risk patient.
Is gastric sleeve still an option if you're already experiencing acid reflux occasionally?
Let me read it. Yeah.
Or if they have acid reflux
Uh-huh.
already, are they a good candidate for sleep?
Again, it depends of your acid reflux characteristics because maybe if there is a hiatal hernia, we can repair it during your surgery and the reflux will go away. Sometimes it's related uh, to your diet or but if there is nothing related to that, uh, the best will be to make a bypass. But if it's something have uh, if it's something we can uh, fix, we will do at the same of the surgery. But if you have a previous endoscopy and it says it's not related to yatal hernia, to your diet, something, the best will be to do a bypass.
I plan on driving myself as I live in Southern California. Will I be able to drive home about 90 minutes drive? Yeah, sure. Um, Make sure you wear your compression socks and maybe like after 1 hour, just get out and walk. You should be fine. Um, uh, so they're asking if they need to do any endoscopic test before they come.
Uh, no, not really, but it depends if we read something that we consider that you need a previous endoscopy, you will know from your coordinator.
I don't understand this. How about Contrave ER? I'm not sure if you understand. It's a Contrave. How about Contrave ER? So let's go the other one. I had lab band 14 years ago, removed it in 2022. Is the sleep recommended over other forms of reloxation?
Yes, it's recommended because some patients they just put the lab band in one occasion, but they never fill it out or was not properly in the site. Yeah, we removed the lab band in those cases and we perform the gastric sleeve with no problems.
Okay, so let me go down. Is it possible to lose too much weight? How do you maintain your weight after the desired amount of weight loss met?
Well, you're going to lose the weight that you want. And the most patient with the sleep or the bypass, the weight loss is between 20 and 30 pounds per month in the first 18 to 24 months. So, but if you don't follow this recommendations of the diet, of the exercise, obviously you're not going to lose the weight that is expected.
I am on estrogen, progesterone, testosterone. Do I need to stop 2 weeks before surgery?
Well, it depends for what do you use it. Uh, in this kind of cases, our internists make these recommendations, and if you need to stop it, we will put the note and we will let you know.
I was looking into endoscopic procedures and I was told long term it can stretch your stomach out. I mean, they're entertaining. So I'm not, so they're asking about stretching their stomach getting stretched after endoscopic procedures. What's the chance of like gastric balloon or endo sleeve?
Well, this kind of endoscopic procedures, uh, it's for more it's a more temporal uh, procedure. Because why? Because obviously they don't cut at the stomach, they don't make a pouch. There are only sutures, and in sometimes these sutures can by the gastric juices uh, broke, and again the pouch can be again big, and you can uh, again you can recover uh, your weight. So the more permanent uh, procedures are with surgery.
What are the things I can do to lower my BMI?
Exercise, diet, uh, and the surgery.
They're asking about the difference between SADI and DS. So I'm going to just go through our website and bring up that page in a minute. And we can go over it real quick. So our website, MexicoBariatricCenter.com, has quite a bit of content, and you can pretty much find things there. It's pretty okay. So this is the difference between DS. Let me put this here for you. Dr. Montalvo can go over it. So the difference between DS and SADI.
Well, Like if you see here, the DS or the duodenal switch and the SADIS is the kind of or number of connections in both of them. In the duodenal switch, we need to make, if you see, one, two connections in the small bowel plus the gastric sleeve. And in the SADIS, there is only one connection and the sleeve. If you see, it's like making a gastric sleeve procedure and like an RNY or the mini gastric bypass in both of them. So is a malabsorptive and a restrictive procedure, and the best or the kind of surgery that we recommend, it will depend of what are your medical conditions or your previous surgeries. But with both of them, you will need to have access to your physician or medical access, because you will need to have or to be more under control with your vitamins, with your minerals, with your diet, with your blood test, all of that.
So does weight affect your period schedule? Because my period has disappeared.
Yes, has the big is the BMI, has the high is the BMI, is more medical conditions. One, it can be the period, because your hormones are not in the level that they need to be. It's more discontrol.
They're asking about the price for gastric sleeve procedure. Our prices starts at 4,395, depends on the surgeon, can be a little higher. Again, if you have high BMI, could be a little higher. And about the discount they asked, we do have a buddy discount. You can ask your coordinators to elaborate on this. Is Dramamine okay for flight home? I get motion sickness. If they take Dramamine for
Yes, no
flight
problem.
sickness.
No problem for the flight.
So they're asking about the medical tourism insurance. Is it legit? Does it pay? So the way it works is you file a claim with them and they would basically, look at your case. But, if you have complications, you should take care of it right away and then get reimbursed from them. But I don't think they will give you a runaround. So it's pretty legit, yes. So they're asking if I'm a CNA nurse, how much time do I need before I go back to work?
If she's a nurse,
Yes.
well, it depends to what do you do at the hospital. Some nurses are at ER or are at the they need to lift the patients. So we recommend, or if you're at the office, you're a nurse, but you're at the office, you can go back. But if you need to make some hard work, 4 weeks.
They're asking what should be my body's ideal weight. I mean, again, we talked about BMI, and BMI is just too generic. We all built differently. Our bone structure is different, but we do have a page. We have actually several pages on our website that talks about they give you formulas and things like that to know, like, okay, if you're male or female and your body structure is this way, what should be your ideal weight or goal weight. So I'm going to just post this and you can read it. I got it. Just there you go. Again, there are several pages. I think we even have a calculator that it shows you what your weight should be. Okay, so let's see. I have to go here. So Jennifer, so just a moment. I am checking on that. Let's get some more questions done. What's the calorie count after surgery?
The calories that they will need, it will depend. It will depend. The first days you will be taking only liquids, but after that, yeah, it will depend of your BMI, and it will depend of how many weight do you want to lose. So I prefer to the nutritionist answer this kind of questions because not it's not for all our patients the same calories that you will need to take. Obviously, in the first days, uh, all of them need to take the same because it's a passive diet that you need to follow up. But after that, it will depend how many weight loss you want to lose.
Okay, so basically all of our pickups are going to be at the San Diego International Airport. That's the meeting place. However, so the way it works is our driver is going to contact you the day before you arrive to San Diego. And if you can, maybe talk to them to meet you at the border. So you can drive to the border, park there, and they can pick you up there. I'm not sure this is something you can kind of, um, resolve or get, arrange with the drivers. Monique is asking, my biggest issue is sweet. How will the surgery help me?
Well, first you need to take off of the sweet to leave them beside all the sweets. And the other is that first, if you're going to take this step, you need to be conscious that you need to make these changes in your life. Obviously, uh, in some times, very occasionally, you can take some sweet, obviously, but it depends of how how many do you take, what kind of sweet you you like. But yes, if you want to change to make these changes, make it beside you.
Okay, so they're asking, what if they can't get a flight to match the times that we need them to come and we need for the departure and arrival? Well, okay, so there's several options. One is you can ask your coordinator to book additional night for you in Tijuana. You could also cross and get a room in by the airport, San Diego International Airport, in like Hampton Inn. They still honor a special rate for our patients. If you mention your Mexico bariatric surgeon patient, they can give you a discounted price, which I think is 169 plus tax. And this is something I just saw the other day, because the prices of the hotel are skyrocketed, and they're pretty much I don't know, maybe $200-300 right now. But I think if you mention Mexico Bariatric Center, you can still get a lower rate. So that way you stay close to the airport and you can use the shuttle to go back to airport. So the driver can drop you and you can go back to airport the next day, whatever the flight time is. So these are your options. The same thing when you arrive, maybe you can arrive a day before, stay in San Diego. It's beautiful there anyway. I mean, you just enjoy the time you have there. Um, and if your flight is running late or is canceled, things like that, you always contact the coordinator. You have the driver's number. You can text, email, call, and make sure we know what's happening so your pickup doesn't get messed up. Okay, so they're asking about medical passes. We do provide medical passes for most of the month. Sometimes at the end of the month, the hospital will say, oh, we ran out. And we try to accommodate as much as we can. And sometimes it's hard to get those medical passes. But for most of the time, we do use medical passes for you to cross to US. Our nutritionist, Christina, contacts you before after surgery. You can contact her before after surgery. She also does webinars that she does for pre-op and post-op occasionally throughout the month. You can jump on those and ask questions as well. So there are so many ways you can do that. Do post-menopausal women have a harder time losing after sleeve surgery? Postmenopausal women have a harder time losing weight after weight loss surgery, or is it about the same?
No, it's going to be the same. It's going to be the same. The changes with menopausal patients is more related with their estrogens, hormones, uh, but when on weight loss, is going to be the same, okay? Because it's more related with the calories that you take, with the absorption, with the kind of procedure that we make, more than the uh, estrogenic or the hormones.
Okay, well, I think that's the last question we're going to answer. We almost hitting a 2 hour here for our presentation, and we're trying to, limit that. So the winner of the webinar is Jennifer Flood. Jennifer Flood, I can see you. I can let you talk and share your story with us. Do you hear me? I think I lost her. I had her in a moment. Let me see. Anyway, there you go. So you still, if you're still there, you're on mute. And can you unmute yourself and share your story? Jennifer, are you still there? Okay. I'm texting her, see if she responds to me. Otherwise, contact our office and talk to your coordinator to get scheduled. Thank you so much for everyone to join us. Happy holidays. We see you after December, which is the first Saturday of January. Thank you so much, Dr. Montalvo, for joining us from Tijuana. I hope you all have a wonderful holiday, and we see you after in January. Thank you. Goodbye.